case of measles in Jefferson County. Other states, including Texas and Indiana, have seen outbreaks of the highly contagious disease this year.
Well, the Kentucky Department of Public Health is giving a bit more information. What the mayor told us says the Louisville child became sick after traveling to another country. With this new case, it brings the total in Kentucky to 13 cases. Louisville's top infectious disease specialist is Ruth Carrico. She's now retired from Norton Healthcare, and before that, U of L. Ruth, thank you for coming in. You certainly got us through the COVID years. Now measles for parents and anybody who are trying to wrap their minds around this. Do we need to be worried about a wider outbreak here in Louisville?
Well, I think the issue is that we have a disease that is transmitted by breathing, and that's something all of us do. So if someone is ill and they are able then to pass this along into the air that others may inhale, if you are not vaccinated, then you are at risk. And we know that this is an issue. When you look at the data now, we're seeing particularly children that are under the age of 5, those have been impacted to the greatest degree. So not only into the number of cases, but also hospitalization. So we know that this is a challenge, but if we can get people to be vaccinated, completely vaccinated, that means that, we want you to have your 2 doses of vaccine as a child, then that we have then strong protection within our community. Now, if individuals travel, as we talked about, then you're exposed outside the United States. You then, if you are not immune to the disease, then you're able then to bring that back into this and other communities, and that's exactly what we're seeing.
So when we had this report yesterday, the first thing I did this morning was call my doctor's office, and I got the feeling that a lot of people saw the story yesterday about the case in Louisville, and they called their doctor's office because I got the feeling that I wasn't the first to call. Now, I know in 1989, before 1989, it was not required to get 2 of the MMR shots, okay?
Right.
I know there are other dates involved, but first let's go back to 1989 because that's a lot of people. So if you only got 1, do you need to get a booster shot? It won't hurt you if you get a booster shot, right?
Correct. And what we know that this is a highly effective vaccine. So I think typically our rate, if you receive 1 dose, you probably have a 97% chance of response, positive response, meaning immunity. That second dose is what bumps you up to 99%. And so I think that, just think, if you are not fully immune and you are around someone with the disease, then you can acquire the disease and then transmit it to others who do not have that vaccine protection.
Is there an age group that you would recommend today? Go back out. You haven't had a measles shot in a long time. Go back out and get another one now.
Well, I think not necessarily get one now, but I think the first thing, as you mentioned, let's find out where every individual is. Do you have access to your health records? Many moms, like, I'm a mom, I still have my children's vaccine records. So if they have a question, I can pass that on to them. Or secondly, ask your healthcare provider, your physician, your nurse practitioner, ask, do we have any records in our state immunization information system, our state registry? That is where we put a lot of this information if it's available. Go and find out what your status is.
If you think you got one, but you're not sure, don't rush out and say, I just need one. You don't need to redo it.
Well, I would talk to my provider because there are going to be some people that we have more concern about than others. So, for example, someone who may be immunocompromised, that they either take medicine that suppresses their immune system or maybe they're undergoing treatment. You want to talk with your healthcare provider to see what does that mean to me as an individual.
When I called my doctor's office today, they said unless you're planning on going out of the country, you probably don't need it.
And I think that's a great point, that we know that people are gearing up now for international travel. They're going all over the world. And it's important to remember whatever is happening anywhere in the world impacts us. So if you are traveling internationally, this is really a time to remember. Talk with someone who specializes in travel medicine. And we have those specialists in our community that can help you. Look at your records, identify where you were going, look at kind of risk benefit, and then have that discussion so you're in the driver's seat.
So if I get measles, what should I expect? It's a lot of people because it's been knocked down by the vaccines for so long, people haven't had to deal with it. Like what's the prognosis for that child? What if I happen to get measles tomorrow?
Yeah, for many of us, it may be a mild illness. We may have kind of this typical cough, runny nose, conjunctivitis, red eyes, and it may not be more than a febrile illness. But for others, and we can't, we don't have a crystal ball to look and say, you're going to have a problem, you're not going to have a problem. So, but we do know that our children are the ones that have been the most heavily impacted by serious disease. Right. And we all want to protect our children, protect our grandchildren. Then on the other end of the spectrum, as we get older, we have less ability to fight infection. So we may then see individuals, grandma, grandpa, others that are at risk. So we're trying to protect our entire community, but as you said, it's always children first.
All right.
Absolutely.
Ruth Carrico, thank you so much for coming in. Retired, but still very involved in the infectious disease specialty. We
Thanks for
appreciate it.
the opportunity.